if you were to start planning this today, you can ask people, would you rather live in a nursing home? No. But you maybe consider living in an ALF? Maybe. Or would you rather stay in your home?
Yeah.
Your home, your family home.
Yeah.
Welcome back. This is the Easy Care Decision podcast. We're in episode 3. In the first 2 episodes, we hit more on the why of what we're doing here, but also just some of the terms that are misunderstood. When we say long-term care, what does that really mean? I encourage you, go back, look at those, listen to those episodes. They're shorter, easy to listen to. At least I hope so. Maybe they're not. Maybe we're just hard to listen to. But today, really what I want to hit on is the logic side of this. I care about my family. I want them to be taken care of and safe, provided for, all those things. But I need to know that the math actually maths. This thing works out. And, with this, if we talk about, hey, does long-term care insurance even make sense compared to my other options, right? There are other things that we could do here. And so that's the conversation we're going to have more today, is the math behind it, the logical side. And again, we talk about easy care decision in the fact that it's an easy care decision when we make these decisions sooner rather than when we're in the place where we need it. And honestly, as time goes on, the further you get down the road, the less options you have.
Yeah.
And you probably see that in your world
All the time.
all the time. And so today, focusing more on the financial side. So first thing we need to know is, what is the actual cost of care? Each month, what are we looking at? What is the outflow of money to do this? And so just looking at some of the numbers here, I'm going to pull those up. The average cost, and understand, we're in Florida, and so these numbers might be a little bit different in your state, but here in Florida, there's a lot of people that are needing care. And so average cost for at-home care is about $5,600 a month per person. So $5,600 a month per person. If you have them come to your home, assisted living is $4,750 a month per person. And then a nursing home, that average right now is $11,400.
Yeah, and just so that we can all understand where these numbers are coming from and why they exist. So keeping in mind the in-home cost, which is about $5,600 a month, what that means is you're having to pay someone to help with your activities of daily living. That is bathing, dressing, eating, moving from one spot to another. If you can't do that for yourself.
Sure.
So it changes a little bit from the assisted living side and the nursing home side being the most expensive for the most part. But when you go into an assisted living facility, you kind of have your base pay. The more you can do for yourself, generally the cheaper it is.
Sure.
Right?
Yeah.
So as you age and you need more assistance, maybe you need a nurse to come in to help with wounds or with your medications. The more assistance you need with those ADLs or activities of daily living, the price goes up because you're having to pay for those services.
Yeah.
And then in a nursing home, the more expensive one, I think, which was
Well, so yeah, the average right now is $11,400. And
right.
And you work in manage nice assisted living and nice.
Yeah, so we sell us everything on my team, from kind of the run-of-the-mill facilities to the really nice ones.
Okay.
So, for example, with the assisted living, $3,700 a month, the nicer the facility, the more expensive. I know that there's one that we cover. It's about $10,000 a month because you're paying for those really nice amenities, the pool, the restaurant, the movie theater.
Yeah. Typically, are those staffed better? Like more staff?
Not really. What we find is the better numbers from your number of patients per worker at the facility actually is best at the smaller assisted living facilities.
Okay.
Because some of those might have a total of 3 to 5 patients. So that's 3 to 5 patients per staff worker at larger versus these larger facilities, which may have anywhere from 100 to 150 with just a skeleton crew.
So that's something to think of too. Like, again, the logical side of, yes, I want you in a great spot, but also what are not just the price, but what are the numbers here?
Correct.
Of nurses that are available. And so when you hear those numbers and you see 10,000 a month or a nursing home that could be 20,000 a month, where do we pull that money from? And there's a lot of misconception of where that money is going to come from. You might have pension and Social Security. You have other bills outside of your nursing facility costs and all of that. But then people are thinking, well, isn't that what I have Medicare for and Medicaid? And we were talking about this right before we came on, and we'll post this as we talk. If you're listening to this, you can't see it, but you can go on the website. If you're watching, we'll have it up right now. But right there on Medicare.gov, if you look up Medicare.gov under long-term care, it says Medicare and most other health insurances, including Medicare supplement insurance, do not pay for non-medical long-term care.
Yeah.
And so when we talk about medical long-term care, that's what you were talking about. People coming in, taking care of wounds, medications, and that's very limited, like a couple hours a week, where who's going to get you up out of your seat and take care of you and get you moving around and all the other things that come with your normal living, helping you go to the bathroom, helping you shower. There's a cost to that. And right now, these numbers, Roger's talking about the nicer facilities, it might be 10 or 12,000 a month. And we're sitting here at the beginning of 2025. And so when we look at inflation down the road, the averages that we're looking at for a nursing home, if it's 11,400 right now, in 20 years, that's expected to be over 20,000 a month.
Yeah.
So the nicer facilities, you might be looking at $30,000 a month to be in a place that you feel comfortable, safe, and not worrying about that. So how the heck do you actually plan for that? And really what that answer is, and what people, it's not just about having a ton of money, but wealthy-minded people understand two things, is leverage and taxes. Leverage and taxes. And an easy way to think of leverage is making your pennies work like dollars. And so you're putting your money in a place that this is what insurance is all about, is passing on the risk to somebody else, to where if you live too long, you're in care for too long, your whole, it's not like everything that you saved and built up for is now totally wiped out and going to these nursing homes. And so I want to talk about that because this is where I had a hard time as a financial advisor early on with my clients. I'm looking at it and saying, I don't want them paying $10,000 a year or, thousands of dollars, tens of thousands, even hundreds of thousands over their lifetime for a policy that if they don't use it, the money's just gone. To me, I have a hard time getting past that, right? It's just, I understand. I have homeowners insurance. We live here where hurricanes come through. And so it makes sense. I'm paying thousands of dollars a year to protect my home. And so I understand the concept, but I struggle with that on the long-term care side of pouring all this money into something that I never could use. And so really for me in this journey of, I understand leverage, I understand the tax benefits of using insurance companies' money, but how do we do this in a way that if I don't use this money, my family can get that money back? And so that's really what, on the discovery of how we came together and having this conversation, I can't remember if we talked about it in another episode, but Roger came to an event that I was hosting. And this is how this really all got started, is he's listening to this and I'm showing these numbers on the logical side. And we're going to get to that here in just a second. And he just said, I didn't know that was a thing. Why don't more people know about this? And we need to have this conversation. That's why we're having this podcast. And so leverage, taxes. So let's actually talk some numbers here. Again, this is, if you're listening on the podcast, I'm going to try to tell these numbers slowly. This is going to pop up here, but this is an actual case, a policy that I did with clients. A lot of times we're sitting here in our late 30s, early 40s, And it's hard to start putting money into a policy when the reality is that's 30, 40 years away. Most people that are in a place at 60, 65, they're retiring, you're taking care of your parents, you're seeing your friends take care of parents, and you're saying, oh crap, this is a real thing that is not too far away from my future that could actually happen to me. But they say it's too late. I can't actually come up with a plan now. Again, going back to easy care decision, the best time to plant a tree is 20 years of age. The next best time is today. And so what I'm talking about here are two 60-year-olds in retirement or about to go into retirement and starting a plan. And so here's the numbers here. In this particular case, they took money. They had $100,000. This was actually in their IRA. I am tax sensitive, so this was not all one taxable event, moving the $100,000. That's for another time. But they took $100,000 and put it into a plan here. And what does that get them? They took $100,000, and what that bought them in coverage is $4,189 a month per person. So conceptually, what's a lot easier to think of, they put $100,000 in, and if they need care, that is $50,000 a year per person. If both go on care, it's $100,000 a year. So you put $100 in, and if the next day you and your spouse need long-term care, this policy is paying out $100,000 a year until you both pass.
And to be clear, this was a $100,000 policy, but you're saying they can get this $100,000 per year.
Yes. Once they go on claim, and this is for 60-year-olds, right? Those numbers almost, you can kind of justify that of like, okay, they're 40, you're probably not going to take it too soon. And even with 60, like, you're probably 20 years away, but this is, what we're doing is protecting the rest of your money. And I tell people it's a permission slip to stay aggressive in your portfolio, to keep growing the rest of your money, knowing that if the worst case happens and you need care and you have to pay for this for a long extended period of time, that box is already checked. And so you've got that permission slip to be able to do that. And it's both on both spouses. So 50 per person. The other side of this is, we talked about, the 100,000 if both of them go on claim. But let's say you're part of that 30% that doesn't need long-term care. In this particular case, the death benefit on this is $140,000. So you put $100 in, you never use the money, but your family is going to get $140,000 tax-free if you never use it. Let's say you used $40,000. Well, your family is going to get $100 back. So whatever you don't use, that's going back to your family. And if you never use it, it's getting more than what you put into it. So that's important. And then lastly, on this particular one, if they decided 20 years down the road, hey, we want actually to take this money out, we're going to Europe, we're going to put a new roof on the house, whatever, they can get access to $94,000 out of that policy to go use. And so to me, when you look at those numbers, even at 60 years old, it makes so much sense to give yourself permission to say, I can spend the rest of my money knowing that my family is protected financially, but also, like, I'm not having to be the one to take care of my wife. I'm a pretty big guy. Like, I don't want my 80-year-old wife down the road pulling me out of chairs if I already just have the money set aside to have someone else come clean me up,
And the reality is, if you were to start planning this today, you can ask people, would you rather live in a nursing home? No. But you maybe consider living in an ALF? Maybe. Or would you rather stay in your home?
Yeah.
Your home, your family home.
Yeah.
Planning this way allows, a way to pay people to take care of you so your little 80-year-old wife isn't trying to do that. Because the reality is, if you don't have the money to do that, you will be forced to go to a facility where you can get the care that you need.
Yep.
So that is one of the reasons I think this is a very incredible, way of looking at this. It makes it easy.
Yep. Yeah. And so we'll go into more of the Medicaid. In the next episode, we're going to talk more about just the national picture. And this is the logical side. And I'll kind of end it with this. As a dad, as a husband, we've had this conversation. Two of our biggest roles as husbands and as dads is to provide and to protect our family. And when I'm having these conversations with couples across the table, usually it's the husband that has the hardest time with this conversation, and their thing is, just take me out back, right? It would just end it for me. I'll stop. I'm looking right at you. Don't do that. Because it's not going to happen. Your wife is going to take care of you. I've got 3 daughters. One of my kids, if my wife can't do it, is going to take care of me. And so to sit here and say, it's just, it's honestly just like lazy logic to just like pass this off and be like, no, I don't want to think about it. Like, no, think about it. Sit there and put yourself in the position and say, if I needed to be cared for, how does that affect my family? And then after you answer that question, the next logical piece is, okay, how do I pay for this? And there are solutions. There are ways to do this that are better than, I hope there's enough money down the road. Like, no, just easy care decisions.
Yeah.
Make the decision now. Just get it over with. And it gives you, again, permission to just go do what you want to do with the rest of your money because you've leveraged what you have and pass that risk on to somebody else. So I hope that was helpful for you. Next episode, we're going to talk more about big picture of what's going on nationally and why we see that there is they call it the silver tsunami of the baby boomers that are turning into the place of retirement and turning 65, and just this massive need for care, and how we see that supply and demand is really going to be a problem where we really need to have this plan secured now so that you're ahead of the game and not falling into a place of you're stuck with whatever's left for you there. So hope this was helpful. Share it. Get the word out. We'll see you next episode.